Hi, my name is Dr. Robert Kane, and I'm a clinical thermologist, and I'm so excited to share a soulful conversation today.
Sunshine, good to see you again. Had to walk out to let you back in. Stuck in a storm of a relationship. Lost my fire. Oh, and I forgot about me for way too long. But it's rolled on. Now there ain't no shade around here.
Everybody, it's Pro Sorenza with Women Successful Living and the founder of our amazing podcast, Soulful Self-Care Conversations. And I'm excited today because a couple weeks ago, I had one of our second, maybe third males on the show. And I actually interviewed with him yesterday. So hello, Bill. And he was like, I thought I was the first male that was on your show. And I'm like, oh, no, you're not the first. And you're not going to be the last, because I knew I was going to have our next guest on the show with us today. And I'm excited, if you can hear already in my voice, to talk about what we're going to share today with Robert Kane, who is a board-certified clinical thermologist. I cannot say that right.
I
An
know, it's
international,
crazy.
international authority on breast and whole body thermography. With over 3 decades of experience, he brings science-based imaging into women's wellness and preventive healthcare, helping translate the body's heat patterns into powerful information about breast health and psychological imbalance and so physiological imbalance. Sorry about that. So we don't edit very well here. So I make mistakes, you guys can all see. But I'm so excited to have you on today because those that are listening, I don't do mammograms. I do thermography. When I go to my doctor, he's always like, when's your next thermography? Because he'll slip and say mammogram. I've been with him like 8 years now, so he's catching on and remembers me. But I want to welcome to the show, first of all. Welcome to our conversation today. How are you today?
I'm doing well. Thanks for having me.
Yeah. So do they call you, what do they call you? They call you Dr. Robert. What do they call you?
Oh gosh, most of my clients call me Dr. Kane, but I'm fine, whatever you want to call me today.
All right, we're going to call you Dr. Kane. So that
Okay.
I love that. So, all right. So first, before we get into all the beautiful things about thermography, I want you to do a little something for us. And that is, I want you to introduce us to little Dr. Kane. When he was little, when you were younger, we want to meet the little child. And what were you like growing up? What was life like? And how does that correlate to what you do today? Back in the day when we're little, we have these big dreams of, I'm going to be a teacher, I'm going to be a doctor, I'm going to be the astronaut, I'm going to be all these things, right? But sometimes our life leads us in different directions that we don't necessarily go that route. So will you introduce us to little Dr. Kane and
Mhm.
tell us what was life like growing up, and what did you want to be when you became this amazing person you are today? And how does it correlate to what you're doing today?
Sure. Sure. I'd say as a small boy, like many boys, I wanted to be a fireman. I wanted to be, a policeman. I wanted to be an astronaut. Of course, growing up in the early 70s with the space program hitting in the late 60s, we all wanted to be astronauts back then. And, but that's, age, 7 to 10, you start growing up a little bit. And as a teenager, I started questioning what I really wanted to do. I loved music. I was thinking about going into music for a while. And that wasn't quite hitting me. But I had some situations where I had some health concerns, and I was getting headaches as a teenager. And then I got, what they call it, mononucleosis, where I got knocked out for 3 weeks, and it was really bad. And during that time, I got introduced to a chiropractor. So that chiropractor was adjusting me through mononucleosis. And the minute I started getting adjusted, I started feeling better. Now, the disease wasn't gone, but I'd say we took it down from a 10 to maybe about a 5 in terms of how much suffering I was doing. And, as I went to college and I started thinking about what I wanted to do, I thought, let me get into chiropractic. I really like the idea of natural health. I like the idea of getting the body to do what it's designed to do and take care of itself. And I'm not opposed to modern medicine. I'm not anti-medicine. I just think that we need to have a secondary, or really our primary approach should be enhance the body's natural mechanisms towards homeostasis. So from there, I got into chiropractic. I had an 11-year chiropractic practice, and I got introduced to thermography, which, by the way, is heat measurement. We map out temperature patterns in the body and look at the circulation and get an idea of how the body's functioning that way. But I started using that for chiropractic, and I was really able to see a lot of interesting things that were being missed by incorporating the imaging. And by 2008, it was very clear that my path was more towards seeing how we can utilize this imaging as a way to empower people to take control of their health. And that's exactly what it's doing. It's allowing, in the breast cancer arena, it's moving the paradigm from detection to prevention. In the chronic pain area, it's taking it away from, I have this nebulous thing called fibromyalgia, to here are the components that can be actually worked on and improved. And it's really opening up possibility. And to me, that is, if I really go back and think about what I always wanted to do, I wanted to create possibility in the world for myself and for others.
I love that, create possibility in the world. And I think that's a powerful, I'm writing it down because I love that statement, create possibility in the world. And there's so many things you said there, like being sick and the preventative part of thermography. And the way I got introduced to it, I know you and I talked about this previously before, is Dr. Carol Chandler. She's over here in Lakeland, and she was one of my clients who, she was on her health and wellness journey to lose weight. So I had the mechanism, and I was helping her, and she was introducing thermography into her practice. She was part of bringing it here to the area, part of, helping it grow nationally. And she actually even did training. So it was one day, I had never had a thermography experience. And she's like, hey, I need a model for training pro. You're here right now. Can you help? I'm like, sure. So I sat down, and we did the thermography. We did head to toe for that training. And I found it so interesting to be able to and understand that how the heat in our body can be factors for preventative, things that are happening in our body, especially around breast cancer. And she shared like how, and I don't know if I'm saying this right, so you can correct me if I'm wrong, but how you can almost see cancer when it's just a tiny little pea, because it's going to show up as this hot mark in your system. And before you feel it as a lump, when it could be too late in some cases, and so I was just so intrigued with that. And then the other part that I when I met Dr. Carol, it's been a long time now, but I remember that was around the time, I think it was the third time they had changed the age for suggesting to get a mammogram. And she was explaining, because my question was, and I was like, why are so many people getting breast cancer that don't have a history of it? And when she started explaining the mammograms and how every time you get one done, you get so much exposure to radiation, how that can come to play. And by the time I met Dr. Carol, the age had changed 3 different times. And had I followed what they said, I would have had, like, in a short period of time, almost a mammogram every year in my 30s, because that was the age that they were changing it to at some point. Like, I think it was 35 then. But I just been so like that. I was hooked the minute I did that with her, because I didn't have the pain of a mammogram. It was not invasive. And it felt like the preventative part. I'm like you with the natural health factor of it. So tell us, like, people hear about thermography, and some of them would go, I remember telling my friend one time, because she was having really bad headaches, I'm like, go get a thermography now, like go in and see what's happening. And she thought I was kooky. And so I'm like, just go have it done. And she did, everything was fine. She's just having bad migraines. But I know that people look at it, when I told her that time, she goes, well, that's what they did when I did a home inspection. They did a thermal engineering of my wall. I'm like, well, I guess you could kind of look at it that way, right? You're looking at the walls inside the walls of your body, right? So walk us through, introduce thermography to somebody who's listening to us for the first time, doesn't know what the heck we're talking about, and tell us a little bit about it.
Right. So with thermography, basically what we're doing is we're taking a camera, just like a photography camera, before they were in our phones all the time. And but this camera is geared towards a very particular type of spectrum called the infrared spectrum. And it's part of the full electromagnetic spectrum, where we look at different wavelengths. And our bodies naturally emit infrared energy. So we can map out the temperature of the body using these cameras. And it doesn't have any radiation, there's no compression. It's literally just getting your picture taken. Now, what does that information mean is the next question. The information is what's called physiological information. And physiology is just a very fancy word for the body's functions. So whereas a mammogram, which, I will say, I do believe mammograms are important. They do play a role. Thermography is not designed to be a replacement, but they are different information. So there's things you're going to get looking at physiology using the thermogram that you won't get looking at anatomy with the mammogram. And you brought up a very good point. Sometimes, when we look at disease, all disease is that the body lost balance. We have all these intrinsic mechanisms to literally fight cancer, fight infections all the time. And something happens where the body's either overwhelmed or it's out of balance and compromised, and it can no longer do that. So our question that we ask as thermographers is, can we use the heat patterns in order to identify imbalance? And if we see that imbalance, that can lead us to an earlier diagnosis, or it could lead us to a situation that we can start moving into preventative mode and seeing if we can actually reverse that process before it becomes a disease. Right? So think about it like with cholesterol and heart disease. Why does everybody care about cholesterol? Cholesterol was like nothing 30, 40 years ago, right? Everybody cares about cholesterol because cholesterol is associated with heart attack and stroke. None of us want a heart attack and stroke. So we have to, quote unquote, manage cholesterol for it. Well, cholesterol is a biomarker. By itself, it doesn't mean anything, but over time, it has a higher risk of developing disease. So the thought is, if we can control the cholesterol, we lower the risk for heart attack and stroke. And there's some evidence to show that. With thermography, we're saying that heat imbalance in the body is a biomarker for different syndromes. And if we can reverse that biomarker, then we can go ahead and start to move into preventative mode. And that's the empowerment part. Right? Wouldn't it be a lot better to, do those things that are going to keep you from getting the problem than just wait every year and hope you don't have it?
Thank you for explaining that, because I know there's many people that go, what is it we're talking about? And I love that you talk about that, identify the imbalance in our body. And it's exactly, and I'm like you, I mean, it doesn't replace mammograms, don't get me wrong when I say that. But it's so, I think it's important to understand, like you said, when we map out our body, what's happening in the body. And if we can get a grasp on it, sometimes if we identify it early enough, we can make changes in our daily lives and what we're doing, eating, or, whatever that might be that can make a change into what's happening in the mapping out of the body and in the imbalances you're talking about. So when people think about thermography, now, one of the things too that I want to ask you if it's changing, but I do know that it's not covered by insurance in most cases, right?
Mm-hmm.
Insurance does not cover it. So when somebody comes in, do they typically, I know I shared how I did the full body, right? But you don't have to do a full body on if you do it. But what would you recommend so somebody that's listening going, I really like this, when should I start? Like, right, what are good times for somebody to start? What's a good first scan to do? Can you walk us through that? And then talk to us a little bit, like, is there talk about insurance kind of covering this? I know at one point I remember hearing, oh, they won't cover it because it's kind of preventative, but have we moved away from that thought process?
Yeah, currently there's no codes that are specific to the type of thermography we do. There are some codes for some temperature measurements. Some doctors try to use them, but they're really not designed to be used for this technology. Honestly, I think we're still a ways for insurance adaptation. The professions are going through transitions right now where we're incorporating a lot of sophisticated AI analysis. We're just modernizing, and the research is starting to come together. And if mainstream medicine starts to adopt it, then we could start to expect insurance coverage. But there's a certain level of evidence that they require, a certain level of professional adaptation. So there's a little bit of politics in addition to science as far as whether it's going to be insurance reimbursable. Now, to answer your second question about where does someone begin? Well, it really depends on what you're looking to do with it. So let me give you an example. If you're a woman and you're looking to make sure that you have the earliest detection possible and that you have data that you can use to actually try to lower your risk for breast cancer, thermography can be started early. We actually image women as early as age 20, not because we're expecting to see breast cancer. I'd be shocked if I did. But what we're getting is a baseline of how their breasts work. And then we can see, are there any significant changes towards imbalance that need to be addressed? Now, I've got a very good friend of mine who I grew up with in high school. We knew each other in elementary school and high school. And I found out later on when I reconnected with her that she had breast cancer at age 38. Now, she found a lump, and they're not screening people at age 38. And I agree. I wouldn't start doing mammograms at age 30. That doesn't make any sense. Their breasts are too dense, and the cumulative radiation for the benefit is not worth it. But if she was doing thermography that whole time, there's a very good likelihood that we would have seen the physiology changing. And we could have said, something going on here. You should really get either a mammogram or an ultrasound. That your doctor can decide what the best test is based on your breast density, age, and the situation. But we would have a flag that said, you need to start earlier. And with the younger breast cancers, they tend to be more aggressive. So this is a population that's unfortunately unprotected.
That's eye-opening. It's definitely unprotected. That's so eye-opening. And I'm hoping, with some of the changes, and we're not going to go down politics, but I'm hoping that they do make some changes that maybe, you get to make a choice for what you're using your healthcare with, because I think many people, if they had the option, would consider a thermography vision. And like you said, I think too, if you have a history of it in your family, to get something early on, and like you said, they don't necessarily do mammograms, too early. Like
Yeah.
having that baseline, I think, is so powerful to have a baseline for sure.
Yeah, absolutely. And then, there are so many other applications of thermography. So, for example, if somebody has symptoms, somebody has headaches, well, we can use the thermogram to start looking, are there vascular components to the headaches, like migraine or cluster headaches? Is there muscle tension components? Could there be a dental infection that's actually contributing to the headache? Are the sinuses all blocked up and that's what's causing it? Are there muscular components, trigger points? There's so many different pieces to a headache. And, I'll tell you, I had 11-year chiropractic practice, and even people with fully diagnosed migraines, and they really had it, 100%, they also had 4 other components. And when we started adjusting, working with those 4 other components, they were getting a level of relief. And migraine patients is a very tough situation, because these people are trying multiple medications all over the place. And sometimes they're getting no relief whatsoever, or they're getting worse. So if we can say it's not just one thing, there are many components colliding, creating an imbalance that now expresses as a symptoms, and we can start piecing out those components and working with them, we've got better healthcare. And that's really the place that I want to go. So it depends on the nature of what you're looking for. Another quick example is if you're an athlete, you can get an imaging done as an athlete. And the idea is not to look for disease, but you're just looking for physiological imbalance. We had a woman image. She was a shot putter in high school heading towards the Olympics. She was already nationally ranked. And me and my partner saw this just not clear as day imbalance on the right shoulder. And I looked at her trainer and I said, I think she's got something going on with the rotator cuff muscles, which are the small muscles that move the shoulder, and they're used for shot putting. And he looked at it. He goes, oh, yeah, I see exactly what you're saying. Let me check her out. He calls me up. He says, you know something? We found an imbalance. When we muscle checked her, she had a little bit of a weakness. There was some restriction in the joint capsule. We're working on her right now. And the idea was we were getting her ready for the Olympics. Now, would she have been fine anyway? Possibly, but could she have injured herself because she had structural compromise to begin with and functional compromise to begin with that wasn't detected because nobody was looking for it?
Wow, that's powerful. It goes to, again, why I'm so supportive of it, because I think those little things can make a big difference. And like, she's going off to Olympics, and having that information, like you said, could she have been injured? Possibly, you don't know. As you're sitting here talking, I'm wondering, I'm from a family that Alzheimer's and dementia runs highly in it. Is there anything that you're seeing with thermography around that? Are there any kind of markers that you might see, what one might see with thermography?
Yeah, with Alzheimer's and dementia, some people are starting to look into it. And the one thing that I'm looking at specifically is called the brain thermal tunnel. And what we found, and this is established now in the literature, is that the corners of the eyes, the inner portion, is called the inner canthus. The lining is so thin that a lot of heat gets out, and we're actually able to monitor brain temperature. So now, when we're looking at brain temperature, we're not necessarily looking at Alzheimer's, we're not necessarily looking at dementia, but we're looking at a biomarker of brain function. Is that altered? So, based upon the patient's symptoms, based upon the objective evidence of that marker rising or falling, showing that we have either increased metabolism, increased body function, or compromised body function, that becomes another piece of the puzzle in order to get them to management.
That's powerful. That's good news for somebody like me that's got in the family. I love that that's
Yeah.
making some strides on there. Okay, so let's talk about somebody makes an appointment, they want to come in for the thermography, right? What can they expect? Because you go in, we're just talking for right now, we've compared mammogram. You go in mammogram and you're getting everything is getting squished and moved and you're standing this way or that way, very uncomfortable. What
Yeah.
what does somebody expect when they come in for thermography?
Okay. Well, the process is pretty simple. I mean, before you go in, you're given a bunch of instructions on do's and don'ts before your exam. Because, if you try to like jog 5 miles and then walk in to do your thermogram, your body's pouring out heat. We're not going to get a good reading. So we restrict you from certain activities for a period of time to make sure that our information is good. Then you walk into a climate controlled room. It's usually cool. And you sit in that room just peacefully for about 15 minutes while your body's getting to that room temperature. At that point, if you're doing a breast examination, you're invited to put your hands over your head. There's about 5 to 7 views that are taken. You literally stand in place. The camera is, I don't know, 10 feet away from you, 15 feet away from you. They'll just say, go into this position, click, and they've got it. There's no compression. There's no radiation. There's nothing done to the body. There's no side effect to a breast thermogram that anyone needs to be conscious of, other than you might be a little cool in the room, but it's not like radiology. I mean, radiology is very valuable, but you do have to look at, is it worth the radiation dosage, which is why they don't screen women at 30 with radiation-based mammography. I agree with that.
Yeah, because I think if I remember right, when I remember what Dr. Carol shared, it's like 5% radiation. It's like, I forget what it was, that you get 5% radiation. And she's like, if you take 5% of that radiation times 10 over 10 years of getting a mammogram, that's 50%, of radiation you're getting. I can't remember the equation's not right, but it was something like that. It was like very eye-opening. I'm like, wow, I never thought about it, that in that perspective. So I come in, I get all that done, and I get the pictures taken, everything. What happens next? Like, what's the next thing I can expect from that reading?
At that point, the images are sent to someone like me, who interprets it. And you also fill out a history form so that we have an idea of what your background is, any recent tests, any concerns. Some people want to have the bright idea of like, I don't want to give you a form, I just want to know what you see. And I can tell you right now, that's not the way thermography is. A lot of it's correlative. So a small heat pattern might not mean anything by itself, but if it's sitting on top of the region of a lump, it might mean something completely different. So I do all that. I'm looking at cross correlations, and we look at 2 major factors. One is the temperature pattern, how the blood vessel patterns are expressing across the breast, how the level of symmetry between right and left. And then we look at specific temperature measurements in different zones. So, for example, the nipple temperatures really shouldn't be more than a degree different. I mean, if there's more than a degree, that's been associated with a higher likelihood of cancer. The areola region, that circle around the nipple, that's about 1.5. So I do all this analysis, and then I correlate it to anything in your history to make sure that we address, if you had pain, do I see any generators of that pain? If there was a lump, do I see any activity that could suggest that lump's more serious and should be evaluated more quickly? All of that. And then a report's generated. Wherever your image gets that report back to you, and you've got all the data you need.
So I get the data that it comes back. Let's say you're reading it and there's a marker there that's a concern.
Mm-hmm.
What happens with that report from there? Does it, what is the next step? What's the next doctor or person that gets involved with that process?
Right. Again, that's going to depend on the situation. Often, a lot of my clients are they're integrative medical doctors, they're naturopaths. So those doctors are really going to manage the case. Now, if somebody's going to an independent center that's just performing the thermography service, at that point, they're going to need to identify practitioners to work with. Now, often the thermography centers have relationships with existing doctors. So if imaging needs to be done, they have a place to send you. If it's a consult about preventative strategies, they'll have, a list of people to choose from to send you to. But yeah, at that point, you're going to need to assemble the team to depending on what's going on. Now, if it's very low activity and there's no big deal, there's not much to do. But if it's higher activity, there's probably going to be some imaging necessary, some radiology necessary to make sure there's nothing serious. And then if not, you can either try risk lowering strategies on your own, or you can seek professional advice and work with, again, an integrative medical doctor, a naturopath, somebody that's more on the preventative side, that can guide you through the mirage of different supplements, lifestyle treatments, and things like that.
So, I mean, one of the things that I love about this is that exactly all the steps you go through, and I find for me it's very preventative. So, what's the average cost? I know every place is different. Every imaging place probably can set its price and so forth. What's the average cost for, like, just say if somebody just wants to concentrate on a breast area or head to toe? What can they expect cost wise for that?
Yeah, I mean, there's a lot of variation. So just kind of take these as ballpark figures. Say average for breast thermogram, maybe $250. Um, Head to toe, we're probably looking at something like 650 or seven, something along those lines. So, we're not at the level of buying radiology MRIs for, $1,000 to $2,000. But, at the same time, we have to, obviously have to cover the cost of the imaging centers and things like that.
And then the next question, of course, is how often should somebody have this done? Like, how often should somebody get a thermography done?
Yeah, it depends on the situation. Again, if somebody's doing breast imaging, if they have a normal breast image and there's really nothing, I'm worried about, we recommend after age 30, do them annually. Okay, so we can track for changes, just like you'd have your annual physical or annual lab work or anything like that. If there is some activity, we may reduce that to either 6 months or 3 months, depending on our level of concern. And then again, monitor based upon what we're seeing. If something's continually progressing, we want to see you sooner to chart that progression. If it stabilizes, well, then we don't need you to see you as soon. We can just be, we can be reasonably confident that we're not going to get much of a change to the next scan.
Thank you for that. And I know, like you said, it varies all over the world, and depending on where you're at, but I think it's really powerful. That's why I want you on this show, because I think thermography is so important. I think we all need to own our healthcare. When we walk in the doctor's office, they get 10, 15 minutes with us. But if we can, I have a naturopath doctor in my world. I see a naturopath. I actually got my naturopathic coaching certification as well with her. But I believe, we have to take control of our health. And there are times when, my doctor, Dr. Narani, I love him to death.
Mhm.
I would go in, he's like, like I said, mammogram. I'm like, no, I send my thermography, and so forth. And so far, knock on wood, everything's been fine with my thermography. But even when it comes to medicine, like I believe in, vitamins, eating healthy and things like that. And he'll ask me when I do blood work, I tell him what I want to make sure he gets off my blood work, not just what the
Mhm.
insurance says. Like if I have to pay extra, I'll pay extra, because I really feel like we have to own our health. We have to own that healthcare piece. And I think it's
Yeah.
really, really powerful when we step into that and own that. Now tell us, so let everybody know, the other question I want to ask you too is, can you let everybody know, like, how long thermography has been around? Because it's not something that's new.
No, thermography actually first came on the scene in the mid 1950s. A Canadian doctor named Ray Lawson in 1957 approached the US military to declassify infrared technology. They were using this to look at ships over the horizon during World War II. It was very crude, but back then you had Japanese battleships that were sneaking, across the Pacific Ocean, and they wanted to see them before they were quote unquote in attack range. So it was a military technology, and it still is. There's still a lot of infrared in military technology. But Ray Lawson actually declassified it for breast cancer, and then he started the revolution. And then there was a tremendous amount of research in the 60s, 70s, and 80s. It tapered off in the 1990s because some of the claims were overinflated. I mean, a lot of people wanted it to replace a mammogram, and it just didn't quite do it. So, unfortunately, the politics of the time was we're just going to get rid of it rather than let's explore what it can do. But now we're looking at a whole new generation of doctors that are coming in, and they're working with computerization, they're working with AI, and the claims aren't as inflated. We're looking at what are realistic claims that are valuable, but aren't necessarily so grandiose that they're going to create political conflict. And we're seeing a resurgence. It's amazing in the last 10 years how much more thermography articles are out there than there were between 1990 and let's say 2010.
That's amazing. I didn't know that history way back then, how when it started out. That's really amazing. So for me, it even validates even more how long it's been around.
Yeah.
It's not anything new. It's not a fad for those of you listening. And I would just say, like, if you're listening, you're intrigued, we're going to share some information with you in a minute, but definitely inquire, ask, and search it out and get some information and sit down with somebody local to do that. But in the meantime, Dr. Kane, can you tell everybody like how they can reach you if they want to learn more about the thermography?
Yeah, best way to reach me is through my website, kanethermalimaging.com, and we can put that in the show notes. So you don't have to worry about how to spell it. But yeah, I have a contact form there. If you want to contact me, feel free at some point next year. There'll be some free resources for patients. What is thermography, how to use it for a bunch of situations. So I'm continually adding to my site. I also have a YouTube channel that you can access through there, which has patient information about the different grades and things. And again, I've got a lot of content that's slated to be launched there. That's going to be fleshed out a lot. So I'd say between the website and the YouTube channel, there should be a ton of information for you.
That's amazing. So I'm so glad you came on. I'm so glad you shared this with us. And I think my next one is scheduled next month in January. I think it's usually sometime in January, and I go get mine done. And we don't have very many when we're here. So I was sharing with you before we came on. I'm going to share it with my chiropractor because I think it's so important that we have these options, like we were talking about, and and owning our own health and going on that journey. I have a cousin right now, my cousin Rhonda, who's been on. She's just recently went through breast cancer, and she had a partial mastectomy, and she like owned her whole regimen and how she approached her treatment and everything. And it was really great because she actually had a doctor who was like, okay, listen, give me the information. I can't tell you I can 100% support you, but as long as nothing is out of whack while we're doing this, I'll be there with you. And all her numbers, like she got rid of sugar, she made all kinds of changes in her life that she was already a healthy person eating anyways, but she just unfortunately had this journey she had to go through. And the doctor near the end of everything, because her white blood cell counts never really changed through her journey of chemo and radiation. He's like, okay, give me more of the information. I can't like promote it because of him being a doctor, but he can certainly slide it off to his clients and stuff. And and she's done really, really well. Her biggest challenge was actually the when they put the breast, what do you call it, the oh my gosh, I can't think of the word now. They went to remodel a breast for her. I can't think of the word.
Oh,
But
yeah.
anyways, her expanders were her biggest issue through her whole journey of cancer was her expanders. That she had problems with her expanders. So
Yeah.
she's been really like, owning her health, even owning that journey. So I'm glad you came on today. I'm glad you shared this thermography. I'm glad we were able to get this out to everybody that's listening. Everything will be in the show notes, so everybody will be able to find you, look you up. We'll show your YouTube channel as well and get that out there. I think it's really, really powerful to have that information. So if you want to learn more, make sure you go out and reach out to Dr. Kane and get that information as well. But before we let you go, I explained to Dr. Kane at the beginning of the show that we have our Better Question, Better Life cards. So I'm going to shuffle these cards, and we're going to have you answer. You're going to tell me when to stop, or you're going to answer your own card you pick. So here we go. Tell me when to stop.
Now.
All right. So your question says, where are my choices leading me? Where are your choices leading you?
Oh, that's actually a great question and an easy question. My choices are leading me to larger and larger vehicles that are going to allow me to help people really take control of their health. Yeah. I mean, we are in a new paradigm. I don't know if you're familiar with Peter Attia. He's a medical doctor, integrative medical doctor, just interviewed on 60 Minutes. And he's talking about longevity medicine. And longevity is not just how to live longer, it's how to live better. So that when we're in our 70s, in our 80s, we have the function that we need in order to enjoy it. And I think he really just summarized exactly and captured exactly what I'm about. I want to use thermography as a way to help people do that, whether it's be freedom from breast cancer, either catching it earlier or avoiding it, whether it's just balancing the body to make sure it's functioning properly, whatever applications we can do. If this is going to help people take better control of their health and live better and age better, I'm all on board. That's where my choices are leading me.
Keep doing those choices because those are very important choices for all of us too as well. I'm gonna have to go look that up on that 60 Minutes interview and go check that out. I love that. My husband and I were just talking the other day. So my mom's side of the family, they live into their 90s. Like my mom's 81. I think my uncle's around 85, 86, and they've got a
Mhm.
sister in between. So that whole side of the family lives really long time. So living long and enjoying it at the same time are two things I want to make sure I'm incorporating in my life. So I appreciate you coming on and sharing with that today. And I just want to remind everybody that we'll put everything in the show notes so you can reach out to Dr. Kane. But before we let you go, we want to remind you that when you do come into this world, we are a rough oyster, but when we empower ourselves and to become stronger, happier, empowered, radiant, and original, we can step into not only controlling our health, but also controlling our mindset and find our inner pearl of greatness. So I hope today you got some really valuable information to go and do that. Have a great day. Cancel. Oh. Okay, so I think you could tell that I was really, really excited about having Dr. Kane on the show. I love thermography. I love everything about thermography, whether it's for your breast, whether it's for, like you mentioned, headaches, or even things that you're challenging with around autoimmune, fibromyalgia, and things like that. I think it's something, if you're not familiar with it, get familiar with it. Go visit his site and really, really hone into what your body is, how you're functioning, what your temperature map is, like he talked about. I think knowing your map is really important, and then early detection is always a great thing because your health matters, and this is just another way to enhance your health and how to manage your health. So I hope you go check it out. I hope that you learn a lot more around thermography, and let us know if you do, because I love to hear your story from thermography. So have an amazing rest of your day, and thanks for joining us. And don't forget, subscribe below. And if you're not sure where you are in your joy today, book a joy clarity call with us and let's help you find your joy. Have a great day.